Anthony. So I'm going to be brief because I want to reserve most of the time for Tim and for the question and answer. Tim Jost is a emeritus professor of law at Washington Lee University Law School. And many of you probably know him, and if you don't and you're interested in health policy and health reform, you should get to know him as the man who writes an extraordinary blog for the journal Health Affairs. I have been spending the last couple of years looking at efforts by presidents to implement health reform using various executive powers, including waivers and executive orders and other things. We started out looking at efforts by President Obama to implement the ACA, and we're now looking carefully at efforts by the Trump administration to, if not repeal, scale back the ACA in different ways. And I have become heavily reliant on Tim Jost's capacity to read very complex legislation, very complex regulations, and somehow in less than 24 hours, distill them into English and publish and write about them in ways that make them understandable and accessible to an incredibly broad audience. So, having said that, thank you for everything you've done for me personally, and thanks for being here today. It's a privilege.
Thank you very much, Mark, for that kind introduction. We have just completed an exhausting 9-month debate on the future of the Affordable Care Act. I see this debate as having ended at a draw. After months of repeal efforts, the Republicans failed in the House. Well, they did succeed in the House of barely passing a bill in early May with a slim 217 to 213 vote margin, which would have significantly amended the Affordable Care Act. Republicans in the Senate tried unsuccessfully throughout the summer to arrive at amendments to the House bill that could attract 50 of their 52 votes. But in the end, the clock ran out on their opportunity to enact amendments to the Affordable Care Act without the cooperation of Democrats through a Budget Reconciliation Act procedure. With this legislative failure, I see us at a stalemate. The Affordable Care Act remains in place as the law of the land, but on the other hand, the Trump administration seems committed to do its best to condemning the ACA to malign neglect at best, and at worst to actively undermining it at every opportunity. And the executive order that was released about an hour and a half or 2 hours ago is another step in that process, and we could talk about that in the discussion if people want to. The ACA and most implementing regulations and guidance remain in place, but the ACA will not operate on autopilot. It needs the active support and guidance of an administration committed to making it work. I don't think we will ever wake up and find that Republicans and Democrats actually share the same values and beliefs about the government's role in our healthcare system. That's what defines both parties in part. In particular, the conservative and libertarian end of the Republican Party and the socialist end of the Democratic Party have radically different visions of the ideal healthcare system that are fundamentally incompatible. But I do think that the ACA has maybe moved public opinion on healthcare issues towards a greater acceptance of a right to healthcare and a greater acceptance of the legitimate role of government in implementing that right. At the same time, the public accepts a legitimate role for cost sharing and for personal responsibility in health. Few politicians can afford to completely ignore public opinion. I also think that disagreements on values does not necessarily preclude working together, even on value-laden issues. Particularly now, we seem to have reached a stalemate on ACA repeal. There is an incentive for moderates in both parties to work together on practical matters. Senators Alexander and Murray have for a month now been trying to come up with a compromise to fund the cost-sharing reductions that insurers have to provide under the ACA. And the last I heard, that attempt is not totally dead. Senators Portman and Warner filed a bill last week providing for much-needed reforms to employer reporting on health coverage, which is a real mess. Sometimes it might be possible to push for solutions that work, even if they are not ideologically pure. In the end, everyone is opposed to unnecessary human suffering. Perhaps this is a transcending value to which we can all appeal. But I doubt we are going to wake up anytime soon and find Democrats and Republicans agree on everything in health policy. The most we can hope for, I think, is that they are willing to look for ways to work together to make our system work better for all Americans, even if these approaches are not fully compatible with their beliefs. Thank you.